IVM.
Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
All right. Hello and welcome to another All Things Policy podcast. And here with me, I have Bhargavi Battala, who is Takshashila alum and currently based in Melbourne. And she works with the Breast Screen Victoria. And she's the communications coordinator for the campaigns that's done there. And to quickly kind of give a context, I met her recently, and then I was so inspired by the work that's happening in Australia more in terms of preventive care that's lined up for the breast cancer kind of an initiative. And I was kind of startled at how much goes into ensuring that a person need not kind of wait for symptoms to appear to kind of get these things done proactively. And a lot of times I think, including myself, we struggle with allowing time to go and get things done for ourselves as a priority. And even there's when, like, say there's me time, I think it's usually about going and spending time with family and not doing healthcare related stuff. So I was quite intrigued by what was happening, and I thought it was worth to do a podcast. And that's why we have Bhargavi with us. So welcome, Bhargavi.
Thanks a lot. Thanks a lot, Soumya. I'm happy we're able to extend the conversation that we had in Melbourne, and I'm very happy to chat about the work that we do here.
Okay, great. So we'll get started. As the drill goes, I kind of look at the framework of the society, government, and the market's role in tackling the different kinds of issues. And so, in that context, starting from the Samaj perspective, right? So, do you think that given this initiative has existed for a while, do people really take, as a common person, right, take that initiative to avail services that's given, I'm assuming, without any cost? So you could also explain that, Bhargavi, how that works as something that's offered, but do people really take it, is what I'm kind of keen on knowing.
Sure. So it's not like, okay, so breast screen as an initiative started in 92, 93. And so how it works is there's a national body that overlooks this program. So there's Breast Screen Australia. And every state in Australia has its own branch, which would be Breast Screen Victoria, Breast Screen New South Wales, and such. But the bodies are actually independent. The state bodies are independent in how they distribute the program, which is a nice thing because you differ from state to state, right? Like,
Right.
though not as heterogeneous as India, possibly, like mostly the culture mostly remains same across states, but the way you live, what you do, and the number of people, everything changes. So the state body has that autonomous power to decide how they're going to distribute the program. There's just a body that looks after how it's distributed. So I think that kind of it ties back into the society, because the program, you have that freedom to personalize the program according to people who live in the state. That gives us the freedom to design our communications, design the program according to how people receive it. And I can speak for Victoria, of course, only because this is where I've worked so far. And so for the question that you asked, where you said, like, do people take that initiative? I would say yes and no. A lot of people take that initiative. They're aware of the program. Some of them, like now we're seeing basically how the program works is it's a 10-minute free mammogram that is provided to women between a certain age group. and you have to get that mammogram done every 2 years.
All right.
That's the recommendation. So every 2 years, we also send a reminder to the ladies to book their breast screen, that it's time for their next breast screen appointment. So make your booking right now. A lot of them proactively book.
Oh.
Even before the reminder comes in, they remember, they have it in their diaries, and they proactively make that booking. And it's mostly people who've screened at least once with us, because they know that it's an easy process. It's pretty straightforward, and it takes your mind off things, right? Like, why we have breast screening is because, like, current statistics show that almost 1 in 7 women in Australia have a chance of getting breast cancer. That is, like, in a room, if there's 7 women, like, one of you has a chance of getting breast cancer.
Right.
Imagine that. So it just takes, like, everybody, I think everybody who lives here knows somebody who has had, or, you know, whose family member has had breast cancer, and they've seen them suffer through it. So that pain kind of pushes them to be a little more proactive about taking care of their health. But this is one set of women. There is definitely another set of women, because of who I have my job, that to promote the program in the community, to make them understand the importance of spending 10 minutes every 2 years to make sure that, okay, your mind is free of that worry. Your mind is free of the worry that, you know, okay, this is one thing ticked off my list. I'm healthy. Okay, let's go ahead and do whatever, like, life has waiting for you.
All right.
So, yeah, and it's not just this program, right? Like, Australia as a nation is a bit of a sporting nation. They're physically active. You see a lot of people going on a walk. The work-life balance is quite nice, and they put a lot of importance and emphasis on including activities in their life that are more. They place a lot of importance on physical activity for leisure. It's not just movies or eating out, or it's not just that. They go on hikes, they go for walks, and they look after each other's health. And so the community itself is pretty proactively looking after themselves, makes our job slightly easier.
Great. I mean, I did notice that, Bhargavi, it's nice that you bring it up. In fact, like how cars are parked in the parking spaces, I saw a lot of surfing boats and other things in places. And I'm like, oh my God, this seems to be a super priority. And I'm sure a lot of people will take a break and say, oh, I'm away for an hour. I'll just go surf and come back kind of stuff, right? So it's that with water as well, like, because it's got a good connection there.
Exactly. Okay. And it's not just it's not just this, right? Like, it's not shunned upon when you say that. Like, if I go to my manager or my boss and say, I'm taking a break, I need to go out and see the sun, I'm not feeling great, I'll be back in half an hour, it's not frowned upon. It's understood. Like, yes, please go out, please go for a walk, come back soon.
Yeah. On that note, I think at least in India, while I talk to a lot of friends, and we are all mid-career professionals, and I talk about mammogram, I think the notion that most people carry is it's painful and it's also time-consuming in a way. So any data point on that? Like, would people be avoiding because they just fear the whole experience of going through it?
I never had, when I just started with breast screen, I never dreamt that people would actually find it inconvenient, because whenever you look at all the information about the program, everything that we advertise says it's a free program, it only takes 10 minutes, it's very quick, so please come and take a breast screen. So I'm like, what is stopping you from actually coming and getting a breast screen? But to devise, like, one of our latest campaigns, which is called Screen for Life, to devise that, when we went out and did a little more community engagement to understand what their fears are, what are the barriers to just coming and getting a simple 10-minute mammogram, it's mostly that. It's people fear the pain, people fear results, people, they don't even have, like, you build up so many things around it that you think, okay, it's not worth, my 10 minutes is not worth there, I'll go buy groceries instead. So there is a fear barrier. There definitely is, like, like with any medical procedure, I think it's basically if you're not informed enough about the process itself,
Yeah.
I think our standard response is to approach it with fear. Okay, what's going to happen?
Yeah.
What will
Yeah.
happen to me?
Yeah.
So there's definitely that.
Yeah.
And there's also cultural barriers, like culturally, especially because I realized this is something funny. Like my people in Australia found very funny when I said, in the context of translated resources, like we have some translated resources that we give out to communities here because like, we're a very multicultural community. And
Yeah.
while translating the words, I was thinking in my head, right? Like what would the word for breast be in my mother tongue? And I couldn't think of a non-sexual word for breast in my mother tongue. Like how would I explain this completely in my mother tongue to possibly my grandmother or my mother? There is no non-sexual word for it. I think it's that taboo that comes with that word and that part of your body as well. So like when we devise campaigns, we have to kind of untangle all these barriers and try to make it as simple as possible to explain the core of the program, to say like, please screen for your health, for yourself and nobody else. It doesn't matter what anybody else thinks. You don't need anybody else's consent, but give them enough information for them to be able to make an educated decision.
Okay. Now, this as the premise, Bhargavi, just trying to understand in terms of cost, right? So there is no cost for an individual at all. It's entirely owned by the government, this program.
So it's partly funded by the federal government and the state bodies. Like in the implementation of the program, we're also funded by the state government's Department of Health.
Okay, so this is purely if there are a few people not making it, then it's purely for personal reasons, like you said. They don't think it's important, and that's why it's not
purely
working.
For that, purely
Right?
for personal reasons.
Okay.
Because the burden of the financial decision has completely been taken away by the government's initiative. All we have to tackle is people's fears and any other barriers that are stopping you from coming and getting a screen.
Yeah. And do you also see that, okay, people who have had a medical history within the family are more, they need probably less of the nudges to get there, because there is one proactive step that they would take to ensure, they catch this probably early enough.
So it's very, very easy. We sometimes we go to all these events hosted by the Breast Cancer Network Australia, which is a very active body because of the number of people who get breast cancer. So when we were at the event, we realized we were mostly speaking to the already converted. Their mother had breast cancer, their sister had breast cancer, or their daughter is currently going through treatment, and they do not need any nudge to come and get a scan. And they are like torchbearers, probably a very big word, but they are the ones who take the program forward. So we have a consumer network of women who take the word out into the society. And most of the people in the consumer network know or are related to people who have had breast cancer. Seeing them suffer firsthand, seeing what they have to go through was more than enough for them to be very active in the community, not just for the screening process, right? Like not just to come and get a breast screen without giving 100 reminders, but also to spread the word, to encourage other women they know to please come and get a regular breast screen.
Great. So these initiatives, like looking at it more from the Sarkar point of view, right? So has the government also initiated other health preventive care schemes like this, not just limited to breast cancer? Are there ones which are...
So in the cancer space, there are heaps.
Okay.
There's like bowel cancer, cervical cancer, and the nice thing is for breast screening, you actually have to come into a clinic or go to one of our mobile screening vans, and a radiographer has to be involved. But for bowel screening and cervical screening, you can actually order a kit. The kit will come to your home. You can there's clear instructions on how to take the swab or whatever samples you need. All you need to do is drop it off at your nearest medical center, at your family GP, or the nearest collection centers as well. So that's all you need to do. You get like a whole collection kit. So in the cancer space, yes, there's a lot happening. And I'm sure there's a lot of initiatives the government takes in other spaces as well. But I think this is like, it's like the discussion that we had before in Melbourne as well, right? One of the reasons, I mean, it's not just about sickness. Like, it's not just about cancer or flu or influenza or something like that. It's also about keeping the citizens healthy. So the government actually plays a very active part in keeping their residents and citizens healthy and active. We've got heaps of parks, and it's very easy to get information about the right food to eat, what to do to look after yourself, and even things like lifestyle diseases like diabetes, right? It's very easy to get information about diseases like that, and how to look after yourself, and how to take preemptive measures. There's Diabetes Victoria. We donate clothes to them all the time. That's how I know that Diabetes Victoria exists. But the work they do is also brilliant, where they give out all this information, try to keep the citizens as informed as possible, to say these are the very simple steps that you can take, that you can make in your life without the involvement of the medical system, to keep yourself healthy, to see that you can try and avoid the disease as much as possible. And this, as I said, comes, I think, because of the universal healthcare that we have. I think Canada is another country that I know that has universal healthcare. But in Australia, I've firsthand seen the benefits of having that universal healthcare. It's called Medicare here. To avoid, I mean, for selfish reasons, right? To avoid the burden on itself, the government has decided that it'll just keep people healthy, and then the burden of disease won't be on the government.
Yeah. And I think it's a lot about even the productivity of the individual, right? I mean, once a person gets into this mode, once they're sick with something, then there are good days, bad days, which are more frequent. And then you have mood swings that will come along with it because, of pain management or whatever that comes alongside with that disease. And I think it's a good way to incentivize and say, like, just more proactive. The kids sound really smart, and I'm glad that the ecosystem in general, right? The parks, like you said, a lot of people just walk around. In fact, to give you a little bit of a Bangalore view, there are a lot of parks for people to kind of access, but it's more so some entity will put up a small tent and say, okay, we are screening for diabetes, and it is very ad hoc. Like, they will arrive on one particular day when it's of national significance or something like that. They'll just put up a temp kind of a system, and it's not like an ongoing thing, like you said, right? I mean, anytime a person can take these tests, and it's pretty much like do it yourself kind of format, right?
And that is so tokenistic, right? I mean, you can be like, well, I wouldn't recommend being tokenistic at any point in your life, but you can be tokenistic about anything but health. And health is an everyday thing. It affects your everyday life. So I think it's like, that is one space the government should avoid being tokenistic as far as possible.
Interesting. And even in terms of how the market has evolved, right? So do you have like a good tech interface that allows you to kind of look at this data closely and track these? And how does it work given the kind of numbers that you might have to deal with?
So data is actually everything. It helps us understand the identity of the people who are screening. And like, don't get me wrong, putting like a few privacy concerns aside, when you understand the identity of a certain community that possibly has low participation rates in a program like this, you understand how to speak to them. You try and explore the ways of communicating to them in their own language. You try and understand the barriers. Is the clinic too far away? Are there a lot of complaints in that clinic? So I can give you an example. Imagine we are looking at a suburb. Like, I'm not going to name the suburb for data privacy reasons, but we're looking at a suburb. The participation in the clinic is really low. And once we deep dived into the data, we realized there are two major communities in that suburb. And one of the communities is actually they screen once and they never come back.
Oh, okay.
There are no return screeners from that community. And there's another community that hasn't even screened once.
Okay.
And they made up most of that suburb, right? And it helped us do a deep dive. Number one, we looked at Google reviews of that branch. And a lot of them had actually said the radiographer was a bit insensitive. There was a lot of shame around exposing yourself to the radiographer, and the radiographer couldn't understand what's there to be ashamed about it.
Yeah.
Like to understand like that people are coming from all these different cultures and they have different fears and different different baggage that they get
Yeah.
into that screening room. We had to understand, we had to look deep dive into all of this data that's available and get like a proper snapshot of, okay, these are the barriers in the community, this is how we can address it. It helps that a lot of this data is provided to us by the government. So when the election commission gives us the data about when women when women enter a certain age, we get like a list of these women with their addresses to say, okay, now they're aging into the program, could you please send them an invitation? And an invite goes out to them to say, happy birthday, and you are now eligible for a free program, and this is the best time to look after your health and such.
Right.
So there are two things here, right? It's not just about having the data, it could be random, but getting data from a reliable source. And the source here is the government. Because they have all these mechanisms in place that were established ages ago, and all these data collection points, you can rely on that data to build all these amazing communication programs for the benefit of the community. So like the amount of data that we get and the amount of data that we generate through the program, because you get all these medical histories and all these the identities of the people, where they live, how far away are they from their nearest breast screen clinic, is that region considered remote, should we have one of our mobile screening vans go into that region, how many women are there, how long should the screening van stay there, where should it go? It's all numbers. So I think data plays like the most important role in distributing this program. And then all these other things, like everything else that we do is again dependent on that data. But without that data, we wouldn't be able to do anything else. We'd just be throwing arrows in the dark.
Interesting.
Stay tuned to All Things Policy. We'll be right back after a short commercial break.
Are there instances when you saw that probably people came in and then because there was early signs of breast cancer, you caught it early and that's why it didn't kind of lead into, basically once it's detected at a phase that's furthered, then the intervention is a lot more intense and it becomes tough, right? I mean, mentally to prepare a person as well as the entire family and others as well. So have you heard stories of people who actually probably, didn't even think about it, but came because of the push and then they see that it was actually worth going through the whole thing?
Oh, heaps. When I just started, we went to this event, I remember, and I was getting bored, right? Like most of the time at events, it's just a waiting game. You're just waiting for somebody to smile at you, and then you go up to them, ask them if they're due for a breast screen, try to book them in, and all of that. But this event was very different in the sense we had a lot of people who are not our target audience, right? Like middle-aged men or like really young women who came up to us and said, "Your program saved my mom. Your program saved my sister. Thanks for all the work you do."
Mm-hmm.
It's not me. Like, I'm not the radiographer. I'm not doing anything, but it's just like, it made me so proud to be a part of a program that does so much for the community. That's when I realized the importance of that. So we were actually looking at numbers as well, right? Like to understand like a proper percentage of women diagnosed who were diagnosed through the program, who and came into the group of early detection, right? And it makes the treatment that much more easier. It reduces the burden on the family that much. And it's not just financial burden, it's also the emotional burden. And breast cancer, like by itself, it's actually, when caught early, it makes the treatment really effective. Like you could go into, there is a fat chance you'll go into remission and lead a normal life afterwards, after your treatment. But the later it is, the more worse the disease is. That's what makes it harder on the person, on the system, like on the government, on everybody,
Right.
make it happen. So there were quite a few instances where like very unsuspecting women came in for their regular screen, saw that there something was found, and went through the treatment. They're all very happy. And the nice thing is, a lot of them are a part of the consumer group now, because they understand the importance of the program. They want to talk about it within their community. So most of the time, they're actually proactively getting our resources, getting some of our badges, some pins, to give it to their peer group, to give it to distribute in their workplaces, possibly, or in their families, to let them know that, this is my story and you should go get a screen. It's not hard. It's a brilliant thing. Please just go get a screen. And I don't think we would be able to do it as effectively as they would, because they've been through that experience. So I think that's, having that system in place is also very important. Having that system where, okay, we've screened a woman, we've sent her off, and that's it. Done. We're not going to do anything else. We have nothing to do with them. It's easy to do that, and our work ends there. But to be able to, like, when women come back to us saying thank you, and this is what has happened, we have another team that we'll direct them to say, like, would you like to be a part of the consumer program? Would you like to speak to other people about it? So even to have that, I think, system in place is really good, to take the word beyond just your normal doling out a program and being done with it.
Yeah, interesting how health ambassadors are like more powerful in a sense, right? Like, because it's on the
Yes.
face. I think when we associate our work and we talk about it, somehow it feels like, okay, you're kind of some people of course complimented, saying that it's so passionately that you're talking about it, but a lot of people can be like, okay, you're so on the face all the time, this is so I think we all.
That, and I think it gets very hard, like, for me, I mean, like, unfortunately initially, unfortunately now, because it's been a learning experience, I feel I started off with this naive thinking that, I'm like, if it's free and it takes 10 minutes, what is stopping you? What is stopping you from just coming and getting a program? How much more should I talk about this? Like, what exactly is your problem? But once you actually go deeper into it, and you have all these other women who've been through that experience, talk to them, and you see the difference it makes, like, yes, okay, you start empathizing, you start trying to communicate with them from their point of view. Like, you walk towards them to talk to them. You don't expect them to come towards you to come and, like, speak about the program.
I think it's a lot relatable, no, when it comes from a friend or somebody. And it's so nice to hear that it goes as a birthday gift, right, Bhargavi? I mean, everybody starts thinking, right? Like New Year, oh, I'm going to get my health checkup done. I'm going to be very prompt with my fitness. And these are like lofty goals everybody is deciding on. And I'm sure with 2024 also, all these resolutions somewhere by the end of December, you realize it's not gone too far. But I'm thinking just having these, even screening for health, right? Like a lot of corporates here as well give packages, but I know my own friends who don't even consider just booking an appointment and going, because they find it very tedious that it takes a whole day, TMT and all of that. That means also you fast for 12 hours. So everything seems like, oh, it's too much to kind of tackle, and you can't spare that one day, which is going to kind of give you indicators of how to you actually look at your diet and everything around it, right? I mean, fitness for that matter is also about how do you ensure that your productivity is taken care, both mentally, physically, right? And just a feeling good factor, because a lot of times these aches, pains and all of that can knock people down. But I like the fact that there's good leverage that's done because of the surrounding, just the physical space once you see a visual of everybody into sports, or looking at boards which have information on how to go about it. I mean, these are good nudges even for somebody who's just walking past it and has not thought through.
Yes. And we are speaking about it. I think I've done a lot of health checkups after a colleague or a friend at a dinner party said, "Oh, I recently visited the GP for this checkup." I'm like, do you actually get that checked up? Because there's the instances of skin cancer is also quite high in Australia because of ozone, sun, and all of that. And I had one of my colleague who's actually quite young who went to get a freckle checked on her back. And I was like, "Really? Do you have to go to get that checked up as well?" And she said, "Just to get my mind off it.
Yeah.
Just to make sure that, it's nothing else and I don't have to worry about it, just to make sure that it's a mole." I think that's really important because for me, like speaking for myself and a lot of other women that I know, you see that little thing and you ignore it as, oh, it's nothing. But you don't think of, like, I don't think you place enough importance on your health yourself to say, okay, this could be something. Let me get it checked and let me have an expert tell me that it's nothing.
Yeah.
Instead of being like, yeah, it's nothing. Okay, let me just ignore it. I don't have the time for all of that right now. And that's the thing about like what you just said as well, right? Like it comes on your birthday and not some other like day of significance, because it's about you. It's about you entering a certain age. It's about your health, about you taking care of your health so that you can be more available and productive for your loved ones.
Yeah.
That's the only way you can do it. It's not like you don't have to, just go under a wheel to keep things running. You can be the driver as well. You can sit in the driver's seat and say, okay, I'm going to take you there.
So true. So did the game change in any way because there were mobile vans which went closer to households, and did that mindset shift because you don't really need to come to a place to get it done, and there is some sort of comfort there?
A lot. Actually, the mobile screening vans, right? They're very interesting in the sense. So when they were designed for really rural and remote areas where it was hard to establish a clinic, and there's just that small number of people. Like you won't be able to fill all the appointments in the clinic as well because there's all that running cost and operational cost that come with establishing a clinic. So there's not enough population to actually fill appointments in a fixed clinic. So you have these mobile vans that go out into like rural and regional communities, and they get stationed for about say roughly 2 weeks or 3 weeks, depending on the size of the community, in possibly your library's car park or the nearest park or like a hospital's car park, and provide free screening services to the community. And the regions have taken it up really well because they understand the importance of access. They don't have access to all these services otherwise because they live so far away from everything. They really appreciate and look forward to the van coming. Like, because of the increase in population in one of our sites, we actually converted that site into a fixed site, which means we established a permanent breast screening clinic there. And started inviting women. But some of the women were still waiting for the mobile screening service to come because they're so used to it and they didn't see it. And we were getting calls to the call center saying, okay, usually at this time the mobile screening van is here. Why isn't it here yet? And we were like, oh, actually, that's when we realized we need to advertise our fixed clinics when they convert. Okay. So we're like, oh, yes, you have a permanent clinic. You can book an appointment whenever you want at your convenience. So please come and book. So for rural and regional women, it's like that. For metropolitan women, when we possibly had the van go out into communities when, say, appointments were not available for a long time, they were like quite a long waiting time, or the nearest breast screen has some problem the clinic has some problem in providing appointments, and we sent out the van to fulfill those appointments. They didn't take to it as much. They said, we'd rather go to a fixed clinic. We're not okay with the van. And even after we advertise saying like it's the exact same as the clinic, the technology is all the same, everything is the same, the radiographers are the same, but they refuse to take to the van. And like mixed bag of reasons. There's no strong reason that stands out. But Well, it's also the privilege of access here. Like, no, we have a clinic accessible. We'll come back later. But when people don't have that privilege, they really appreciate the service coming to their community rather than them having to travel, I don't know, like 100 odd kilometers to access a simple service.
Yeah.
Because the breast screen itself takes 10 minutes, and if you have to drive an hour for that, kind of like smooth point providing such a quick service.
True. I think that's the interesting bit, right? Like when you make that service available, and like you rightly put it, the access being right around the corner, it's more compelling for you to finish it off because, oh, there's a van. Okay, it's just 10 minutes. All that comes together. Whereas when you have to book an appointment and you need to take time out, maybe it's just a little extra bit, right? And it's also interesting to understand how all of us, in fact, when you said it might feel like a compromised care when it comes into a mobile van, I was like thinking, oh, how would I respond to it? And I initially would have thought something similar, though somebody would have convinced, like you rightly put it, the tech is the same, you have the same technology that's put in there. I mean, like, okay, maybe I should just hit the clinic kind of stuff. I think it's just the mindsets, right? We're all used to a traditional track of having it at a clinic, and you feel, it's a better infrastructure, at least in our head.
Of course,
There's
of course. For me, it's always something my grandmother said. She always used to say, when you have a full stomach, that's the only time you can think about anything beyond that. But if your stomach itself is not getting filled, that's all you can think about. Like how to get that food, how to get that one bun.
yeah.
So, for me, that is very relatable in this scenario, because in the rural and regional areas, it's like, I just need to get a screen. I don't care who's giving it. I don't know what's happening. If the clinic is coming to my so close to me, I really appreciate it. But when you have everything else, when you have the access, you're okay to wait. You're like, that's okay. Even if my screening is pushed away a little, I'm okay.
Yeah.
So I think that very apt. What my grandmother said is very apt in this situation.
Right. Okay. Interesting. Yeah. Thanks, Bhargavi. I think it gave us all tangents, right? Like what we should do, what probably the government is doing already in Australia. I think there are a lot of learning points to understand how this entire mechanics of, what it takes to for people to be a little more proactive, and then also ensure that there is a tech enabled data that gives you enough insights to say what's working, not working. Even for me, that fact that somebody calls you from a place and says that where's the mobile van, versus where you have a clinic that got established because of some data input there, is nice to say that, okay, we think some things are obvious, but a lot of times people need that input, right? Because for us, we're working with it, and that's why we don't see the need to communicate it enough. So I think a lot of these inputs are useful, and I'm sure it's going to help all of us to also decide that on our birthdays, while we cut cakes and celebrate, in a lavish way, it's also important to care about these things that are truly the ones we should, ensure that we don't miss. Right, forgetting
Of course.
having a party or not, you've got to take care of these things. So, thanks for your time, Bhargavi, and sharing everything that goes into making the breast screening at Victoria and places in Australia so meaningful, right, as an approach. And happy to know that there are so many do-it-yourself kits for other things as well. So, healthcare to a large extent, the entire ecosystem. I think we also forgot how the COVID is more like a forgotten past already, right? I keep thinking, when we were in the midst of it, there was so much conversation about why our healthcare system should look different, or, what we should do as individuals. I think now we have kind of stopped thinking about it. So it's a great input to understand process. So thanks for being here with me.
No, it was my pleasure. It was definitely my pleasure. I love working in this space, and I love talking about it any chance I get.
I'm glad. Okay, you take care then, Bhargavi.
Take care too, Soumya. Thank you.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, If you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaInst or our website takshashila.org.in.